Hi, my name is Zach. Today I'm going to be demonstrating the application of injectable medications. So first we're going to verify the MAR. Patient's name is Manny Stickins. Date of birth is 12/15/XX. Patient's been diagnosed with AFib and diabetes mellitus and has an allergy to penicillin. Today we're going to be administering the 0900 medications. We have Demidose 0.8 milliliters. It'll be administered intramuscularly. And then we also have 7 units of insulin R and 14 units of insulin N, both of which are going to be administered subcutaneously as they're administered with meals. And then finally, we're going to be administering 0.1 milliliters of Practitube PPD intradermally, and then that test will be read in 48 to 72 hours. So now that we've verified that the MAR is good, and then the MAR has been verified by Nurse Kat Ryan, initialed by KLR, we're going to go ahead and go to the Pyxis, and we're going to pull our medications. So the first thing we're going to do is we're going to grab an ampule. And this ampule is 2 milliliters, which is plenty for us to drop for the 0.8 milliliters of the Practi-Amp, or or Demodose, whatever you want to call it. And this expires in February of 2029, so we have that out. We're also going to get the insulin, so we have insulin R. This expires February of 2029, and then it's 100 units per milliliter, or insulin R here. We also are going to pull the insulin N, expires February of 2029, 100 units per milliliter. And then finally, we're going to pull the Demodose, or apologies, we're going to pull the Practitube PPD, and this expires in 2030, February of 2030. So now that we have our medications, we're going to, and they've been verified, they're not expired, we pulled the right medications, we verified it against the MAR, we're going to move on to the nurse's station, and we're going to gather our supplies. So for this, we're going to need an alcohol swab, a few alcohol swabs. We're going to need a 3 milliliter syringe. We're going to need a filtered straw, and we're going to need a needle to administer intramuscular. And this is 22 gauge by 1.5 inches long, so this will work for intramuscular. Then we have to get a needle for our Practitube. So this is 25 gauge, and it's 5/8 of an inch long, which will work for our intradermal injection. And then finally, we just need a needle to inject our insulin. So we have a standard insulin needle here. This is 0.3 milliliters or 30 units, which is large enough for our 21 total units of insulin that we're going to administer. So now we're going to move on to drawing up the medications. The first one we're going to start with is going to be the Demodose via the intramuscular. So really quickly, I'm just checking out my surroundings. I need to make sure I have a sharps container and a trash can. So we have our trash can here, so I can waste properly, as well as our sharps container. Don't want to block any views. So the first thing we're going to do is, after performing hand hygiene, we're going to come up to the Practitube of the Demodose. We're going to flick the top to make sure that all medication is in the bottom of the ampule. And what we're going to do is we're going to tear, cover like so, and we're going to break away from us. So breaking away, And then this is gonna go into sharps. And then what we're going to do is we're gonna open up our filtered straw, and we're also gonna pull up our syringe. We're going to affix the filtered straw onto the syringe. Okay. And then while not touching the sides, we're going to insert the filtered straw in. And we're going to drop the 0.8 milliliters. Apologies. There it goes. So we're going to draw this up, and we're going to go a bit past just to ensure that we get enough of the medication. Okay. And then we're going to open our needle. We're going to remove our filtered straw, dispose of that in the trash, and we're going to open up our needle for the intramuscular injection, which, as a reminder, is 22 gauge and 1.5 by 1.5 inches. We're going to draw this out, and then we're going to waste over the trash until we reach our desired measurement of 0.8 ml. We're gonna flick, make sure we get any air bubbles out. Perfect. And we are at 0.8 here. That's 0.8. And then we're gonna place this back into the wrapper just for safe handling. And then we're gonna keep this out just so that we can grab a piece of tape and label. And then we're gonna pull this information off and verify it against the MAR. So we have our demo dose, 0.8 milliliters administered intramuscularly. This is for 0900. This expires 02/2029. We have the required information here. So we have the amount of the name of the medication, the dose, the route, and the expiration date. And we're just going to attach this to the syringe, not covering the markers on the needle itself, or on the syringe itself. So we have that here. So this is ready to go. And now we can put this into the sharps container. So next up, we're gonna draw up our insulin. So the trick for insulin, first thing we're gonna do is we're going to roll the medications, make sure that they are well mixed while not introducing excess air bubbles. And once that is sufficiently mixed in, we're going to remove the one-time lids, since these are brand new. Put those into our trash. Then what we're gonna wanna do is we're gonna wanna take an alcohol wipe per lid, and we're gonna wanna wipe these down for 30 seconds each. I'm just doing this for a demonstration, so this would be 30 seconds, as well as here. We would come here with a fresh alcohol swab, 30 seconds. All right, and then what we're going to do is we're gonna drop the necessary air, so the 7 units of insulin R plus the 14 units of insulin N is gonna equal 21 units. And then I am just confirming that this insulin is unexpired, 100 units per milliliter, insulin R. And then this is the insulin N. It's unexpired, expires February of 2029, just like the insulin R. Insulin N, 100 units per milliliter, which matches everything, and it's unexpired. So now we're going to get the correct dosage. So what we're going to do is we're going to draw out 21 units of air. We're going to inject that air into the insulin. So the first thing we're going to do is we're going to inject into the insulin N, and we're going to be injecting 14 units of air into the insulin N. So cloudy first. We're going to insert. We're going to inject the air till we hit the 7 line, which will be 14 units. Good. Oop. And then we're going to also inject, the 7 units into the insulin R. And then we're going to take this, we're going to rotate it up, and we're going to draw up the 7 units. Ooh. And then we're going to drop the 14 units from the insulin N. To equal 21 units. Okay. And then we're going to safely recap this. And once that's on, we can affix the lid. And then we're just gonna place this in this empty wrapper here just for safekeeping. I'm gonna keep these out so I can draw up my triangle label. And then for this, it's going to be 7 and 14 units, insulin. So 7 units is insulin R, 100 units per milliliter. This is per the bottle. This expires 02/2029. That's good there. Oh, and then this is getting administered sub-Q. And then 14 units of the insulin N. 100 units per milliliter. This expires February of 2029, administered subcutaneously. So now that we have our nice flag ready to go, we're gonna, without obscuring the marker on the needle, we're gonna fix this. And that is right there. It's a little bit tricky with this small of a syringe with this amount of medication, but we'll make do. And without obscuring any information, we have our label here. That's ready to go. And then finally, we just need to prep our, and then this can be placed back into the Pyxis. And then we have our Practitube PPD. This expires February of 2029. 5 TUs per 0.1 ml. That matches the 5 TU per 0.1 ml. We're going to be administering 0.1 milliliters. So we're going to draw that up here. Before we inject that, we're going to take another alcohol swab. And again, like with the insulin, We're going to wipe down for 30 seconds. 30 seconds. So we're gonna take our needle. We're going to first drop the 0.1 milliliters of air. And then we're going to being a little difficult. All right, so now that that's out, we can inject this into our PractiTube. We're gonna flip this around, inject our 0.1 milliliters of air, and then we're going to draw our 0.1 milliliters of medication. We're gonna draw just past that just because of air bubbles. We're going to remove this and then putting the cap in a safe place, hands back. We're gonna recap the needle and then I'm gonna waste this over. And that's perfect. So then we just need to create a label. And then this is 0.1 ml of PractiTube. The 5 TU per 0.1 ml variant. We're administering we already wrote that, so we already have the 0.1 milliliters written intradermally, and then this expires February of 2029. So that tag's ready to go. Just like so. We're gonna place that back. We're gonna make sure all of our trash is thrown away. We're gonna take medication back to the Pyxis. And now that we have completed our second medication check and writing the medications at the nurse's station, we are going to move on to patient bedside. So we're no longer here. We're in the patient's room. Patient's right here. Have our sharps container off to the side. I'm gonna knock. Hi, Manny. Hi there, Manny. My name is Zach. I'm a student nurse. I'm gonna be helping out to administer your injectable medications, if that's all right. All right, sounds good. Before we get started, can I just confirm your name? Perfect. Date of birth, 12/15XX. Fantastic, thank you so much. And then I'm just mentally noting that the MRN does match as well as the primary care provider. So in order to get started, I'm just gonna observe the patient, paying note to any current IVs or anything like that already in the patient, making my decisions on where to administer. Their patient is not hooked up to anything currently, so any site is fine. I'm gonna go with all right, Mr. Stickens. So today I'm going to be administering your 0.8 milliliters of demo dose, your insulin R&N, and your PractiTube tuberculin skin test. So for the intramuscular, we're gonna pick the right ventrogluteal. So we're going to go to that site and we're going to use hand hygiene and don gloves. which I'm currently out of, but I'm wearing them. And then we're going to take our demo dose. We're going to verify it against the MAR. So demo dose 0.8 milliliters intramuscularly, and this is unexpired, so this is good to go. And then for this, we're going to pull the skin, pulling it tight and away. And before that, we're going to uncap the medication. So we're going to pull the skin tight and away, and then we're going to inject this at a 90-degree angle. And we're going to aspirate. Good, nothing, no blood's coming up. Good to go. And now we're going to inject our 0.8 milliliters. Keeping that tight. Inject. Come out. And release the skin. And then this is going to go into sharps. And then we're going to apply pressure, not wipe. And before beginning this, I wiped the skin with an alcohol wipe. I brought an extra with me with my supplies. So we wiped. So now we're on to the second medication, which is going to be the insulin. For this, we're going to go with the right lower abdomen, at least 2 inches away from the umbilicus. So we're going to get our needle. We're going to just verify 7 units insulin R administered subcutaneously, 100 units per milliliter. This is unexpired. And then 14 units insulin N, 100 units per milliliter, unexpired, injected subcutaneously. So for this, we're going to see if we can pinch an inch. It doesn't appear that we can, so I'm going to inject this at a 45-degree angle. So we're going to take an alcohol swab, wipe this down, and then we're going to take this. We're going to insert this, bevel up at a 45-degree angle. So like I said, we were unable to pinch the inch, but we are going to still try and pinch, inject, or insert, inject the medication, and withdraw. Apply pressure, but do not rub it. And then this gets placed into the sharps container. And then finally, we have the Practitube, and we're going to administer that in the right forearm. This is indicated, or I'm sorry, yeah, right forearm indicated by right arm. I'm going to just come over and verify 0.1 milliliters, Practitube, unexpired, 02/2029. This is going intradermally. So, apologies, the lid did not stay attached, but the lid would come with this. This seems to be a slightly janky needle. So we're going to take this. We're going to wipe the site down with an alcohol swab. We're going to remove the lid, and then we're going to just inject this about 1/4 of an inch, bevel up. And the trick here is we want to see a bleb when we inject. And I see the bleb. I'm going to remove, apply pressure, and place into sharps. I'm going to throw away my trash. And then I'm gonna just line everything out on my MAR. So we administered 0900 of the demo dose. I'm gonna initial, and I'm gonna denote the site. So this was the right ventrogluteal. And then for the insulin R, we administered that, and the insulin N administered that, and initial both. And these were both administered into the right lower abdomen. And then finally we have Practitube, and this was administered at 0900, so we're gonna write in the time and line it out. We're gonna initial, and then this was administered into the right arm. And then I'm just gonna sign Zach Smithley, SCCSN. and my initials. And then before leaving, I'm gonna confirm if there's anything else I can help the patient with, and then I'm making sure the patient has access to the call light, bed is lowered to the lowest position, 2 rails are up, so patient safety is ensured, nothing that they could potentially trip over, and my MAR has been verified, and I'm good to go.